Imagine this. In just 1 hour of walking, our feet experience a load of approximately 450 times body weight. This is an enormous, truly colossal load, especially considering that the foot is a very complex structure made up of 26 bones and 33 joints. With such constant stress and everyday use, it's not surprising that various foot problems can develop over time. In this video, we will discuss 5 main causes of foot pain and, of course, explain how you can help yourself in each situation.
Heel spur, plantar fasciitis. In everyday language, this condition is often called a heel spur, but the correct medical term is plantar fasciitis. Most often, it appears quite suddenly. Everything feels fine one day, but the next morning, a person gets out of bed, steps on the heel, and feels as if they have stepped on a Lego brick, begin to work, and the sharpness of the pain decreases. However, discomfort often persists throughout the day. A very typical scenario: a person sits for a while, for example, an office worker at a desk. During this time, blood circulation in the heel area stabilizes. But once the person stands up again, the same sensation returns, as if something sharp is stuck into the heel. To understand why this happens, it's important to know the anatomy. From the heel bone to the toes runs the plantar aponeurosis, plantar fascia. This is where the term fasciitis comes from, since the suffix itis means inflammation. Due to overload, micro tears and inflammation develop at the point where the fascia attaches to the heel bone, causing pain. The body constantly tries to heal this damaged area, but every time you step on the foot, the tissues are stressed again. As a result, there is an ongoing struggle between healing and repeated microinjury. In some cases, instead of soft tissue repair, the body begins to form bone tissue in this area. On an X-ray, this appears as a small bony projection, what people commonly call a spur. It's important to understand that this bony growth is not the true cause of pain, but rather a compensatory response to chronic irritation of the plantar fascia. Diagnosis usually includes a medical history, physical examination, and X-ray imaging, where this bony projection may be visible. The term heel spur stuck because it resembles the spur seen in birds, such as roosters. However, from a medical standpoint, the real issue is inflammation and micro tears of the plantar fascia.
2. Stress fracture, March fracture, Recruit's disease. Stress fractures most commonly affect the second and third metatarsal bones. This condition is also known as a March fracture or Recruit's disease. It typically develops after prolonged walking or heavy repetitive loads, a classic example being soldiers during long marches with full gear. An interesting feature is that early X-rays often show no visible fracture, even though the person experiences pain. Only later, when the bone starts repairing itself, does a bone callus become visible on imaging. A stress fracture does not involve a complete break. Instead, the bone develops tiny cracks, similar to bending a green branch. It cracks internally without breaking apart. Because there is no displacement, early X-rays may look normal. Common signs include mild swelling in the front part of the foot and pain. During examination, pressing on the head of the second or third metatarsal bone causes noticeable tenderness. In early stages, MRI is much more informative than X-ray, as it clearly shows bone marrow edema around the affected area.
3. Osteoarthritis of the foot joints. The most commonly affected joint is the first metatarsophalangeal joint, the joint of the big toe. Osteoarthritis here involves not only cartilage degeneration, but also the formation of osteophytes, bony growths on the head of the first metatarsal bone. Over time, this bone enlargement limits movement of the big toe. When the toe tries to bend during walking, it collides with the bony growth, causing pain. This creates a mechanical conflict between the bones. Normally, when walking, the foot rolls forward and the big toe bends. In people with osteoarthritis, this movement is restricted, so pain appears. To avoid discomfort, the person subconsciously changes their gait, shifting load to the outer part of the foot. This leads to overload, limping, and additional discomfort.
Flat foot, pes planus. As the name suggests, flat foot occurs when the arch of the foot collapses. In a healthy foot, the arch is supported by ligaments, tendons, and muscles, providing shock absorption. In flat foot, this support weakens. One key mechanism is the outward deviation of the heel bone, which stretches ligaments and tendons responsible for maintaining the arch. As a result, the arch falls, and X-rays often show a flattened foot structure. Symptoms may include burning sensations, pulling or tearing feelings, dull, aching pain. A very common complaint is that in the evening, after removing shoes, the person feels as if their feet are burning. Flat foot is often bilateral, affecting both feet. Flat foot develops slowly, and people adapt by reducing activity. However, as it progresses, ligament stretching and altered foot mechanics can affect the lower leg, knees, hips, and even the spine.
5. Hallux valgus, bunion. Hallux valgus is a valgus deformity of the big toe. The first metatarsal bone deviates outward, forming an angle between the first and second metatarsal bones. As this angle increases, the deformity progresses. Because ligaments and tendons are attached to the big toe, the toe itself begins to deviate outward as well, forming the characteristic bump. This causes tension, inflammation of the joint capsule, redness, and pain. Sometimes patients complain that their fourth and fifth toes rub against shoes. This usually happens not because of toe deformities, but because the bunion pushes the shoe outward, increasing pressure on the smaller toes.
How to quickly reduce pain and inflammation before seeing a doctor. Self-treatment is not ideal, but until you see a specialist, you can. 1. Reduce foot load. Avoid high heels and tight shoes. Choose sneakers with soft soles. 2. Wear properly sized footwear. Shoes that are too narrow or too small often worsen pain. 3. Avoid iodine grids. They do not help and can even cause skin burns if overused. 4. Pain relief and anti-inflammatory medications may temporarily reduce symptoms until medical evaluation. Treatment approaches. Overview. Plantar fasciitis. Custom orthopedic insoles. Foot-specific exercises. Massage. Improved circulation. Shockwave therapy. Hormonal injections may reduce pain quickly, but can weaken tendons and cause recurrence, so they are used cautiously. Hallux valgus. Toe separators and corrective devices. Exercises. Insoles. Taping. Surgery in advanced cases. Osteoarthritis. Conservative treatment mainly relieves symptoms. Surgical treatment is often required to address the cause. Stress fracture. Unloading the forefoot. Activity modification. Sometimes immobilization. Flat foot. Custom insoles combined with therapeutic exercises. Strengthening foot muscles is essential to avoid dependency on insoles alone. Final note. If you suffer from foot pain and want proper diagnosis and effective treatment, it's important to consult a specialist. Thank you for watching until the end. Subscribe to the channel and share this video with those who may find it useful.